Hey, what's up guys? It's Dr. Kels coming to you live from Fit Club Chelsea. On today's episode of Injured Reserve, we are going to go over Joe Burrow and his recent knee injury. If you haven't seen the play, it is a little gruesome. He unfortunately had a traumatic injury to his right knee, and he sustained that unhappy triad. That is where we tear your ACL, meniscus, and your MCL. In today's video, what I want to go over is some of the assessments that they use on the field to determine what exactly is going on with the injured player, in particular at the knee joint. Check it out. So, the first test that we're going to perform today is our anterior draw test, and this is a test to look at the laxity and the function of the ACL. All right. So for this test, we're going to bend the knee just under 90 degrees here. I actually like to sit on the foot to anchor the foot down. I'm going to place my hand behind the tibia here, and I'm just trying to pull the tibia towards me, directly towards me. Basically what I'm looking for is laxity in the knee, right? Someone who has a torn ACL, there's going to be no end feel or a loose end feel, and we're going to have a ton of motion in the knee joint. So again, this is our anterior draw test. So that's the first test for the ACL ligament in the knee. Our second test is going to be the Lachman's test, right? So for this, we're actually going to extend the knee a little bit. I'm going to block the bottom part of the tibia with my hand. And again, I am grabbing the posterior aspect of the tibial plateau, and I'm looking to draw, again, that tibia towards me. What I'm looking for is pain, laxity, and excessive movement. If I see all three of those, there might actually be an absence of pain if the nerve endings are torn, but the laxity is really what we're looking for. We're looking, and if there's excess laxity, there will be a positive test for a torn ACL. So those are two tests that you might see on the field for the ACL ligament. Our third test we're going to do is called a posterior sag test. So this is for your PCL. Basically what you're going to do is you're just going to hold the knee up here, and what we're looking for is to look at not only what's happening with your patella or your kneecap, which is going to live right here, but next we look at this tibial tuberosity, and we want to see is that in line with the patella. Someone who has a torn PCL, this tibial tuberosity is going to be depressed down. So that shows us that there's some posterior laxity in the knee, right? We have negative tests here because we see that they are in line. So those are going to be our tests for your PCL. Next, in the unhappy triad, you have an ACL tear, you have a meniscus tear, and you have an MCL tear. The next test we're going to show you guys is our Valgus stress test, which is a test we use to determine if there's MCL, laxity, or dysfunction. So what we're going to do is we're going to lift the knee up here. We're going to apply a force to the outside of the knee, which is actually going to stretch the inside aspect of the knee, and we're going to go into extension and knee flexion. Knee extension and knee flexion. What we're looking for, again, is excessive motion as well as pain specific to the inside part of the knee. If we get those two things, we have a positive test for MCL dysfunction. And that's our, again, dynamic valgus stress test. The last test that we're going to do now is for the meniscus, right? The meniscus is the soft tissue that lives between your femur and your tibia. It allows us and serves as a cushion between those two bones. So this is called our McMurray's test, right? So what we want to do is we want to externally rotate the foot, and what we're going to do is we're going to bend the foot into some knee extension, and then we're going to keep that external rotation as we go into knee extension. We're going to keep that external rotation as we go into knee flexion, and then we're going to keep that external rotation as we go into knee extension. Next, we're also going to then internally rotate the foot and the lower leg, and we're going to do the exact same thing. We're going to come up into some knee flexion, and then we're going to extend into knee extension, going back and forth while keeping the lower leg internally rotated. Again, we're looking for pain provocation here around what's called the medial or lateral joint line of the knee. Those are two things that we're looking for a positive test that lets us know that the meniscus is also involved in a traumatic or any knee injury. All right, guys, if you like this video, you love this content, make sure you subscribe, like the video, drop a comment below. Any injuries or anything that you would like to see us cover, really appreciate your feedback. Thank you, and until next time, peace.